Which of the following is most likely to cause an embolic stroke during cardiac surgery with CPB? A. Use of an arterial cannula. B. Intraoperative manipulation of the heart. C. Use of a heparin-coated circuit. D. Low-flow CPB. Correct answer, B. Intraoperative manipulation of the heart. Explanation: intraoperative manipulation of the heart is a common cause of embolic stroke during cardiac surgery with CPB. During surgery, plaque or thrombus can be dislodged from the heart or aorta, leading to embolism that may travel to the brain, causing a stroke. Use of a heparin-coated circuit helps reduce thrombus formation, and low-flow CPB is a risk factor for ischemia but is less directly related to embolic events. What is the most appropriate treatment for patients who develop postoperative cognitive dysfunction, POCD, following cardiac surgery with CPB? A. Use of cognitive-enhancing drugs. B. Early rehabilitation and cognitive therapy. C. Aggressive pain management. D. Prolonged sedation. Correct answer, B. Early rehabilitation and cognitive therapy. Explanation: early rehabilitation and cognitive therapy are the most appropriate treatments for postoperative cognitive dysfunction, POCD, following cardiac surgery. These interventions help improve cognitive function, reduce delirium, and prevent long-term cognitive decline. Cognitive-enhancing drugs may have limited efficacy, while prolonged sedation and aggressive pain management are not effective for treating POCD. Which of the following is a direct consequence of cerebral hypoperfusion during CPB in adult cardiac surgery? A. Increased risk of myocardial infarction. B. Postoperative cognitive dysfunction. C. Electrolyte imbalances. D. Increased wound infection risk. Correct answer, B. Postoperative cognitive dysfunction. Explanation: cerebral hypoperfusion during CPB can lead to postoperative cognitive dysfunction, POCD, which may manifest as memory issues, difficulty concentrating, and other cognitive deficits. Myocardial infarction and electrolyte imbalances are also significant complications but are not directly related to cerebral hypoperfusion during surgery. Wound infection risk is unrelated to brain perfusion. Which of the following statements is true regarding the role of the blood-brain barrier, BBB, during cardiac surgery with CPB? A. The BBB is always fully intact during CPB. B. The BBB is more permeable during CPB, allowing for increased cerebral injury. C. CPB has no effect on the BBB. D. The BBB is protected by high-dose steroids during CPB. Correct answer, B. The BBB is more permeable during CPB, allowing for increased cerebral injury. Explanation: during CPB, the blood-brain barrier, BBB, becomes more permeable, allowing inflammatory mediators and other harmful substances to enter the brain. This can contribute to cerebral injury, particularly in the setting of systemic inflammation and hypoperfusion. The BBB is not fully intact, and the use of steroids is not sufficient to prevent BBB dysfunction during CPB. Which of the following is a key component of the neuroprotective strategy used during cardiac surgery with CPB? A. Maintaining normothermia. B. Use of high-dose vitamin C. C. Reducing cerebral oxygen demand. D. Use of high-dose dopamine. Correct answer, C. Reducing cerebral oxygen demand. Explanation: a key component of neuroprotective strategies during cardiac surgery with CPB is reducing cerebral oxygen demand. This can be achieved through measures such as mild hypothermia, which decreases the metabolic demands of the brain, and maintaining appropriate blood flow and oxygenation. Normothermia, high-dose vitamin C, and dopamine do not directly address cerebral oxygen demand in the same way. Which of the following is the primary cause of cognitive dysfunction after prolonged cardiopulmonary bypass, CPB, in cardiac surgery? A. Hypotension during surgery. B. Cerebral microemboli. C. Hyperthermia. D. Hypercapnia. Correct answer, B. Cerebral microemboli. Explanation: cerebral microemboli are considered the primary cause of cognitive dysfunction after prolonged cardiopulmonary bypass, CPB, during cardiac surgery. Small embolic particles, such as air or clot fragments, can travel to the brain and block small blood vessels, leading to ischemic injury and subsequent cognitive dysfunction. Hypotension, hyperthermia, and hypercapnia may also contribute but are less directly related to cognitive impairment compared to microembolic events. Which of the following is a common cause of delayed neurological deficits after cardiac surgery with CPB? A. Increased cerebral oxygenation. B. Persistent systemic inflammation. C. Excessive blood transfusion. D. Early extubation. Correct answer, B. Persistent systemic inflammation. Explanation: persistent systemic inflammation is a common cause of delayed neurological deficits after cardiac surgery with CPB. Inflammation can cause damage to the blood-brain barrier, leading to cerebral edema, neuronal injury, and delayed cognitive dysfunction. While excessive blood transfusion and early extubation are important aspects of postoperative care, they are less likely to cause delayed neurological deficits compared to ongoing systemic inflammation. Which of the following strategies has been shown to reduce the risk of postoperative stroke during cardiac surgery with CPB? A. Maintenance of moderate hypothermia. B. Use of high-dose corticosteroids. C. Use of intraoperative brain monitoring devices. D. Use of low-dose heparin. Correct answer, A. Maintenance of moderate hypothermia. Explanation: maintenance of moderate hypothermia during cardiac surgery with CPB has been shown to reduce the risk of postoperative stroke. Cooling the body helps to decrease cerebral metabolic demands, providing neuroprotection during periods of low cerebral perfusion. Intraoperative brain monitoring and use of heparin are important but do not directly reduce stroke risk as effectively as moderate hypothermia. What is the most likely reason for postoperative confusion and delirium after cardiac surgery with CPB? A. Inadequate pain management. B. Neuroinflammation. C. Pre-existing cognitive impairment. D. Elective use of sedatives. Correct answer, B. Neuroinflammation. Explanation: neuroinflammation is the most likely cause of postoperative confusion and delirium after cardiac surgery with CPB. The systemic inflammatory response triggered by surgery, CPB, and ischemic events can cause changes in brain function, leading to delirium. Inadequate pain management, pre-existing cognitive impairment, and sedation can contribute to delirium, but neuroinflammation is a primary factor. Which of the following is a key indicator of cerebral hypoperfusion during cardiac surgery with CPB? A. Increased serum creatinine levels. B. Decreased mixed venous oxygen saturation, SVO2. C. Elevated lactate levels. D. Increased pulmonary wedge pressure. Correct answer, B. Decreased mixed venous oxygen saturation, SVO2. Explanation: decreased mixed venous oxygen saturation, SVO2, is a key indicator of cerebral hypoperfusion during cardiac surgery with CPB. Low SVO2 reflects inadequate oxygen delivery to tissues, including the brain. This can indicate insufficient perfusion during surgery, which increases the risk of cerebral ischemia. Elevated lactate levels may also indicate hypoperfusion, but SVO2 is a more direct marker for brain oxygenation.